Rapidly advancing stem cell research is reported to be helping improve the treatment of non-communicable diseases worldwide. Regenerative medicine and therapy can be used to replace damaged tissues and organs through transplanting stem cells. CGTN's Anastacia Waweru tells us how Kenya is making strides in this sector and what this could mean for cancer patients.
The World Health Organization's International Agency for Research on Cancer announced in 2020 that the global cancer burden had risen to over 19 million new cases and 10 million deaths. It's projected that 1 in 5 people will develop cancer in their lifetime, and those numbers are expected to rise by about 50% in the next 20 years. Kenya's Ministry of Health reports that cancer is the second leading cause of death in the country among non-communicable diseases. Research on regenerative medicine and therapy couldn't come at a better time. We are here at the Kenya Medical Research Institute, where the country's first stem cell research lab has been unveiled. The facility is expected to spearhead stem cell research in the country and on the continent. Some of its benefits include the fact that patients suffering from non-communicable diseases may not have to travel abroad for treatment. We're talking about regenerative medicine for cancer, diabetes, cardiovascular diseases, road accident injuries, burns, and more.
When we regenerate the cells from the bone marrow, we put them in the incubator where we grow them and in flasks, and that is what we have here. And this is what we get from our cultures. We use them for downstream application. That means for the diseases that we are investigating, for example, diabetes, we use diabetes in mice and then use these stem cells and just to observe in mice and see whether they assist in wound healing, whether the process is accelerated or otherwise.
These efforts will boost the development of new therapies to regenerate repair tissues that have been damaged or affected by disease. Stem cells can also be used for drug discovery and testing, as well as organ transplants.
In terms of diseased conditions, for example, cancers, if you have cancer that is affecting one of the organs, and I want to give an example of the liver, and it is not functioning, then it can regenerate, okay, to be functional again, and so that it can serve its purpose. So stem cells potentially would come in place and to manage that. Mostly the cancers, because cancers affect specific organs.
And as the prevalence of non-communicable diseases increases, contributing up to 50% of inpatient hospital admissions in Kenya, scientists and researchers are calling for more action to fast-track solutions.
For us to move from bench to bed, that is from lab work to the patients, we need to bring in medics, that is clinicians, and everyone else. We also have to have the right policies in place for that to happen. So we need the policies in place. We need the funding, that is very critical, and also capacity building.
The unit is set to also create a database of information sharing of stem cell research, further supporting Kenya's emerging biotech industry. Anastacia Waweru for CGTN.